Welcome back to Island Life Live. October is World Blindness Awareness Month. And if you or someone you know is dealing with vision problems, we've got a few friends that can help make things clear. Take a look. Seeing properly is critical for work, for school, for life. But when you're not seeing properly, you want to go to the experts. We've got them right here with Aloha Vision Consultants. I know that you folks are leading not just Hawaii, but the world when it comes to cataract surgery. Please, Dr. Tokunaga, lead us into this.
Well, we utilize advanced technologies like femtosecond lasers to correct astigmatism and for increased precision. We're really excited to introduce the newest innovation, which is the Odyssey intraocular lens.
Astigmatism, that's a spooky word, yeah?
Oftentimes, yeah, it can sound kind of scary, but we actually have an expert on astigmatism, Dr. Julie Como, who's on our team.
So astigmatism, it sounds really scary. It's definitely not. It just means that the eyeball is not perfectly round. So instead of it being round like a soccer ball, it's more oval or elongated like a football shape.
Now, how would I know that I have an astigmatism?
So astigmatism, it might present itself as blurriness. You might see some glare, or the vision might seem distorted. You could get some side effects from that, like eye strain or headaches throughout the day as well.
And this happens in people of all ages?
Definitely.
So even our little keiki that are just going back to school right now, if they're having a hard time seeing the board or if they're having a hard time reading, they may have an astigmatism and we don't know.
Absolutely. So this can affect someone from any age, from a young kid to an older adult. So if you know someone or you yourself are noticing those symptoms, it would be good to, come in and get your eyes checked so we can take a look.
Dr. Como was so awesome, guys. Thank you so much for introducing us to her. But let's go ahead and start talking about these lenses that you folks implant.
So we're so excited to have the new Odyssey intraocular lens. This is a new lens that basically came about from using AI computer models to create what the models and computers are saying would give us the best vision. That allows people to see in almost like HD-like quality with continuous vision from far away, computer and near with no gaps in their vision. So it's really amazing. But a couple months ago, they did run some numbers to tell us how much we had implanted. And personally, I implanted over 10% of the entire world's implants at that point.
You?
Personally, yes. And Dr. Tokunaga was well up there too and implanted a large percentage of the world's implants. Between the two of us, we have quite a large number of implants of the Odyssey lenses.
This is amazing because I can imagine with our aging population and those that are suffering from cataracts and astigmatisms, they're going to need your work, right?
First off, you guys aren't lucky to have us. We're honored to be here and we're honored to help people in Hawaii because this is where we both were born and raised and we grew up here and we're just taking care of our own population. Oftentimes, the Asian Pacific Islander population is left out of so many of our research studies and there's not enough evidence regarding them. And so, we thought, well, what can we do about this? We got to help our people, right? We got to help the people of Hawaii. So we decided, well, let's come up with a research study to examine, do these Odyssey lenses work well in the Asian Pacific Islander population? We were really blown away by the results. Well, first off, everyone knows what 20/20 vision is.
Yes.
That's having perfect vision far away. So in our study, 100% of patients who had Odyssey implants, that's 100%, every single patient who had bilateral Odyssey implants could see 20/20 vision at distance without glasses. That really blew us away. And that was in our Asian Pacific Islander population. In fact, a large percentage of those patients could see better than 20/20 far away at 20/15. That's the lowest our charts go in our exam room.
Oh my gosh, this is, I think, first of all, I think it's amazing that you focused all of your research on our people. But the fact that these results are so amazing, honestly, I just can't imagine why people wouldn't be knocking down your folks' door to come in and get this kind of work done. With our vision, what is this? I see this is a chart on the wall normally, right?
Yeah, so this is a reading card, and what we use this for is we use this to measure people's ability to read. And so what you do is you hold it about 2 shakas away from your face, about 14 inches or so, and then you try to read the tiny little numbers here. But in our study where we implanted Odyssey lenses on patients, it was pretty amazing because the patients could read tiny print like down here without glasses.
That's crazy.
And that blew us away. In fact, every patient in the study except one could read the finest print here. And that patient could still read this, but they were used to reading so up close, they wanted the weakest pair of readers to see that tiny, tiny print way down there.
That's like font -5 or something.
Yeah, it's 4 font.
This is amazing. I love it. And this is the great work that these brand new lenses are doing.
Absolutely.
This is exciting. How can people find out a little bit more about Aloha Vision Consultants, not just this incredible technology, but also all the other great work that you folks do?
Well, if you feel like you need our help or you might need our services, please feel free to give us a call. And you can reach us at 808-782-1861 or www.alohavisionconsultants.com.